Okay, this is chapter 31, the child with articulation or musculoskeletal dysfunction. And just like this picture shows, we're never going to give up. There's always a way to get these kids up and moving and save them from, this is saving the frog from the bird, but saving them from the problems that their illness and disability brings. So immobility. Immobility is a bad thing. Our bodies function best when we're upright, when we're moving. That it gives us increased venous return, it keeps muscles strong, it keeps bones mineralized, and when we don't move, we get problems really in every system. But they're kind of can fall into three different categories of problems. It can be from decreased muscle strength. We get muscle wasting and atrophy. It can be from the decreased metabolism because we're not moving and doing things. And we get bone demineralization when we're not up and weight bearing on our bones. There's also psychological effects though, particularly for kids. They're not getting the sensory input they usually do, and this can affect a lot of things. Can affect their self-image when they see themselves as the child who's not able to move when everybody else can, and it can delay them reaching those developmental milestones, even ones that aren't part of the immobility problem. So, and here's a picture, a table out of the book that shows all the different effects on the different systems. And if you just kind of look through it, I mean, we affect every system really by not moving. Our bodies work best when they're active. Oh, I thought I took this picture out, but this isn't from the textbook, but just realize one of the causes of immobility is accidents, and often kids get hit by cars. What'll happen, that car will hit them and break their femur, hit the chest, so you get contusions to the lungs or the chest, and then they get flung over and they hit their head. So whichever side the contusion and the femur are on, the opposite side of the head, you're going to have a head injury. So now we're going to look at different types of injuries. We're going to start with soft tissue injuries. Contusions, these are bruising of soft tissues, and this is where you get ecchymosis. You get your big black and blue marks. We want to apply cold. Actually, any of these, our first response is going to be to apply cold, but with a contusion we want to apply cold for at least 24 to 48 hours. Our next type of injury is a dislocation, and this means the bones are not aligned at the joint. The ligaments should hold the bones in place, and somehow the ligament gets tugged so that it's crooked, or holding the bones crooked. So really a dislocation is a problem with that ligament not holding the bones the way it should. Sprains, this is when the ligament has a small or large tear, or it's just really stretched out. So we can damage that ligament and some of the other soft tissues, and a child will say it feels loose. Often this is an ankle or a knee, and this is usually, it happens in an accident or an injury. They fall, they get hit by something happens, but it happens, you know, all at once. A strain is really similar to a sprain. We're talking about micro tears in the muscle or tendon. It's painful, it's swollen, but this is usually something that happens over time, kind of overuse injuries. You do the same thing repetitively until you do some damage. And this is not from your book, this is from an older book, but it's still true. Kind of shows what happens to the tissue when you have these soft tissue injuries. We get swelling, increased pressure under there. That compromises some of the small blood vessels, so we're not getting good tissue or good oxygen blood perfusion to those tissues. So we get decreased nutrients, which makes it harder to supply, well, decreased blood flow, so we don't get the nutrients we need. We also don't remove the waste products, and we're not getting the oxygen, one of the nutrients, and that leads to cell death, cell necrosis. Some of the other things that may be going on at the same time also make it contribute to that cell death. We may have broken skin, pressure from equipment, severe hot or cold on there, or inadequate nutrition or hydration. That all causes that cell death. And then if we have opened sore, we now have an easy route for germs to get into the system and go systemic. It's going to take time for us to get from there to tissue regeneration. We're going to need good nutrition and good blood flow, adequate perfusion. In order to get tissue regeneration, we need to make sure we've got enough protein. Okay, so how do we manage soft tissue injuries? I always just use the acronym ICE, but your book says ICES or RICE. You can use either one, and they're very similar. ICES says that we put on ice, we use compression, so we kind of wrap it up, we elevate it, and that means above the level of the heart, and then we support it. So if especially if the child says it feels loose, we want to keep it wrapped or some sort of a support on it if they're using it at all. The other acronym you can use is RICE, which is resting it. So while it's injured and hurting, they should not be using it. And then the ICE, compression, and elevation. And this is elevation, A. The problem is often people do B. To really promote venous return, it's got to be above the level of the heart. So it requires a child laying down with the extremity elevated above their heart, not sitting up on a couch. B is certainly better than the leg hanging down farther, but it's not the same kind of elevation as A is. Okay, different types of fractures that we can get. A bend or plastic deformation. Kids can do this because their bones aren't ossified the way an adults are. A buckle, this is where you get a bump that sticks out, and this is usually kind of part of the healing. You see this. A green stick is where it bends and it cracks a little bit, but it doesn't quite break, just like a stick off a tree that's a little too green to be able to snap it and break it. When you almost break it, it only breaks halfway. And then a complete fracture or oblique. And I have another picture, again this from a different text, that shows a little more clarity on different types. Closed fracture being there's no skin involvement. Right below that, an open fracture. The problem with an open fracture, the bone is poking through the skin, so we have a great route for introducing germs into the system and into the bone. Extracapsular or intracapsular has to do with inside or outside the joint. If it's splintered, where you have, it's kind of shattered. That's that bottom one. Longitudinal, it's broken not straight across, but kind of in this parallel to the long part of the bone. Our most common fractures are just transverse fractures, but they can be oblique, so that's kind of at a slant. You can see it's not just straight across. Spiral means it kind of twists up. It's not just straight across. And let me just say, spiral is pretty much always something that needs to be looked into further. That is rarely from a fall. That's almost always a sign of abuse. And then pathologic fracture, there's something wrong that allows the bone to fracture. And you can see you can have the two pieces can be, they can stay in alignment, they can have a gap between them, or you can have where you've got some angulation. That's got that green stick fracture. Didn't quite go all the way through, but you've got a weird bend to it there. Okay, so how do bones heal from fractures? Well, first it makes a hematoma formation. This can be called a procallus, and it takes 24 to 48 hours to do that. And then we get proliferation of the cells. This takes about 2 weeks, where that hematoma changes to granulation tissue, a callus forms, and it kind of makes a collar around the bone, so it actually looks larger. If you look on x-ray, you'll see this callus area that's bigger than the bone itself, and then that turns to a bony callus. Starts out softer, turns bony, and then we get ossification of the bone. That's 3 to 10 weeks, and then that extra callus formation gets reabsorbed, and that can take up to 9 months. So it's certainly stable once we have probably a good bony callus. Certainly by the time it's ossified, it's very stable, but it doesn't mean it's not still tender. I know I broke a bone in my hand once, and I couldn't shake hands for at least 6 months because people's fingers would touch right on that site, and it didn't hurt anymore unless somebody touched on it. And you can kind of see the initial inflammatory process is the shortest one, then rebuilding that bone is the next longest one, and the remodeling, kind of taking down that extra tissue that was used in rebuilding the bone, is the longest process. So what do we see when somebody has a fracture? Well, the general signs we're going to see are swelling at the site, pain or tenderness, and diminished function. The child's not going to be able to use that site without a lot of pain. You can sometimes see bruising, sometimes severe muscular rigidity, so the muscles around it kind of spasm and contract. Crepitus, sometimes, but not always, you'll get crepitus. Crepitus is both a feeling and a sound. It's that grinding, crunching sound when you rub two things together, like, you know, two rocks, where you've got a little bit of sand or something between them. It kind of goes. It's also a feeling when you touch on it, and it feels exactly like the sound, which if you felt it, you know what I mean, but it's hard to explain that other than it feels just like the sound. Okay, how do we assess fractures? We want to use the 5 P's, looking for pain at that point of where the injury is. Pallor, so we're looking at the color distal to the fracture. Pulse, again distal to the fracture site. Paresthesia, which is sensation, and paralysis, can they move it? And you may be more used to CMST, color, sensation, movement, and temperature. I'm not sure I did those letters and words in the same order, but same idea. We just have pain included in this, and we made them all P's. And I think that's a good spot to stop.